Here's some bills that NASW has helped to develop that have been introduced in Congress, except for this climate change bill, which is still in a draft form. The Protecting Social Workers and Health Professionals from Workplace Violence Act would provide funding through grants for greater safety measures for social workers and other health providers. Loan forgiveness, student loan forgiveness. Right now, there's been a complete changes to the public service loan forgiveness program, which I'll talk about briefly later. But one of the reasons that some social workers and other public service professionals may not qualify is that they completed their 10 years of service in a qualifying nonprofit or public service employer and now find themselves not working for a qualifying employer. This bill would change that. So we helped with this and helped to draft it, and one thing that's crazy is they wanted to communicate, the office wanted to communicate that these are career changers. I'm like, no, we haven't changed careers. We just changed employers. We need to make this program, the Public Service Loan Forgiveness Program, contingent on public service and not the tax status of the employer. So that's the value, is that you're educating these offices and that they in turn can help us. We do have a bill on climate change that we've developed in coalition with many other individuals and experts that would essentially fund community-based responses. I think this is a mechanism, you all, to find a way to bill for addressing social determinants of health. Our experts are saying that the climate crisis is among us and that we're going to see layered disasters that disrupt our everyday life, that we can't get to work, or that schools are closed, or that entire neighborhoods are having to evacuate, and there's going to be devastating mental health impacts. Our workforce, we're not prepared to handle this. The whole entire behavioral health workforce isn't, because the structure of reimbursement doesn't allow for community-based, community-involved, community-driven, or led responses. NASW is at the table leading the development of that. We have a bill on integrated care that would allow us to practice in the collaborative care model and to have those positions initially funded through legislation. We serve two roles in this model, as an LCSWC consultant and also as a behavioral health care manager. If we can get integrated care in primary care offices, we can prevent really severe behavioral health problems. We're closer to having more access to coverage and services, and we work with other groups like American Psychiatric, to get that bill introduced. So I'm hopeful that we can get support for that through these packages. That's one of the ones that the provisions could be included. We have a bill on school-based social work that would fund school-based social workers in addition to a technical assistance center and evaluation of school-based social work, because there's not a standardized scope in school-based social work. And what clinical social workers do providing psychotherapy is not the same as what those social workers are doing in the schools, and we have to convey that. So this is a wonderful bill. I think there's a chance we could get provisions included. Again, we all need to write to our lawmakers and say, advance these bills through these packages. And there's one in differential response in policing that would allow for social workers to act as first responders. And I want to say something about this. One of our colleagues, Michael Sheridan, is the founding director of the Center for Social Development at WashU Brown School, and he would say, we should be thinking about a new institution for public problem solving. What if they send social workers when a baseball goes through a windshield? Like, we have to get out of our mind what we understand police or crisis response to be and step in to where there's something positive. We're very good, you all, at problem identification. We need to focus our powers on where the solutions are. And this is something that there's interest in this. I was on NPR on behalf of the association talking about the alternative response in policing. We did alternative response in child welfare. We've already kind of talked about this Improving Access to Mental Health Act, but we need to get this support for this bill. We have the most sponsors that we've ever had in the probably 8+ years that we've been working on this. We're paid 75% of the physician fee schedule in Medicare. Psychologists are paid 100%. For psychotherapy, almost the identical service. And that's holding us back because that's setting a kind of low bar for what commercial insurance is provide, and we're not operating at our full scope of practice. In fact, our scope and reimbursement hasn't been reevaluated since 1989. Yeah, and I think the key barrier here is budget. It's going to be expensive. I think likely, I don't want to guess how much time, but I think other providers will be admitted to provide services in Medicare, and that's going to be a good thing, you all. So counselors and others will eventually be able to practice in Medicare, and we want the full continuum of services, including substance use disorder services, to be covered in Medicare. There is enough need for all of us. But we're not going to get our interest advanced unless we make some noise. Because if we sit by, we will not, this just could stay the way it is if it's good enough as it is. We should demand that CMS tell us how many social workers are participating in the Medicare program, how many people are actually receiving these services, because we suspect that they're not accessible. And that's just not acceptable. Our older adults deserve more, and that's the kind of advocacy that we need to do.